Dr. Irene Kling is a licensed speech-language pathologist and vocalogist. She has years of clinical experience, specifically in stroke rehabilitation, voice, as well as transgender voice therapy. She is a adjunct professor at Adelphi University, in addition to having a private practice and treating a variety of clients. She brings a wealth of knowledge and experience to her profession, and we are so happy and grateful to have her join us today. So, how did you get into the field of speech-language pathology?
I was an actor and a singer, and work was not always that available for me, and I was always interested in voice and speech. And even when I worked as an actor, I worked with actors to develop their voices and worked on diction and classical work and all of that. And then work was getting fewer and further between, as we might say. And so because of my interest in voice, I decided I wanted to perhaps take a course and see what it was like to actually explore it in a more scientific way than what I had done before, which was more of a coach kind of a thing. And so I took anatomy and physiology and phonetics just on a lark, and I was hooked and never looked back.
It's amazing. It's absolutely amazing. Yeah, I remember you telling me you were acting and,
And that's always helped me work with all kinds of clients.
Yeah, no, absolutely.
Singing, acting, especially with transgender.
Yeah, no, yeah, absolutely. And it's a very interesting, I guess, subspecialty or area that you specialize in. So you have a variety of clinical experiences. Which one is your favorite and why?
I can't say I have a favorite. I mean, I seem to have, it turned out that I've specialized in two primary areas: stroke rehabilitation and voice. And voice includes working with actors and singers, customary voice users, and transgender voice users. So I guess you could say those might be my favorite, but I do, I like to work with people who have articulation problems, lisps. I've done a lot of work with accent modification in the corporate world, that kind of thing. I do like variety, but my practice seems to have become more focused in the last 15 years, I would say, in voice and stroke. And then I had many, many years at Rusk Rehabilitation at NYU, where I worked primarily with stroke and head trauma. And that's always been a very important area of work for me.
Right. And so, so you, like you had mentioned, you do specialize in transgender voice. So how did you get into that type of work?
Again, some of this is serendipitous. When I was working at NYU and I was supervising students, I thought that working with trans clients would be a very good way for them to learn about counseling, because this is a very disenfranchised part of our population, and they're underserved. And I thought, well, there's the voice component, there's the counseling component. This is something that we can offer that's very important for people. And at the same time, as I said, our students will learn a lot. So we started a transgender voice group, and our students really rallied. They loved it. And then when I left NYU, now I'm at Adelphi, we started a transgender voice program with my colleague Steve Cox. And that program has become huge. So we see private clients, and we also have a transgender voice group, and all our services are free of charge.
It's amazing. I think it's also, when you say free of charge, I think it's something that's really special because, as we very well know, therapies and different support services can be very pricey, and not everyone has the means to to pay and to do something free of charges, certainly.
And the universities have really stepped up, and around the country and the world are offering these programs. And Adelphi, we actually won an innovation award, I should say, a couple of years ago for our group. So that's
amazing.
extremely
Congrats.
rewarding, and our students are learning a lot from that. Yeah.
Amazing.
Yeah.
One of the areas, as you had mentioned, is that you specialize in is stroke rehabilitation, and specifically you work with those that have aphasia. What is aphasia? What are the different types? Is it a progressive disorder?
Well, typically, aphasia, if you want to, and I'm going to speak about this in a general sort of way, is a language disorder that is a result of brain damage that affects people's ability to understand and process what's being said to them, sometimes understand what they're reading, their ability to write, express themselves in writing, and express themselves in language, so that they may have word finding problems, a lot of difficulty accessing information at the time that they want it. And sometimes those problems are also part of an overall cognitive deficit, where attention and memory, concentration, focus, those areas also can impact negatively on language. There are many types. I think for our discussion, it's best to just, divide them into fluent and non-fluent. Non-fluent meaning that the person struggles both to find the language to express himself, to write that language, and fluent meaning that often the person is actually hyperverbal, but a lot of what is said has what we call neologisms, which are words that really aren't real words. And they struggle immensely with processing information. That's very characteristic of the fluent aphasias. When you ask about progressive, there is an aphasia called primary progressive aphasia, which is very difficult to work with because it keeps progressing, as the name implies. And very often, most of what we do there is work with the family, trying to maintain as much communication and the use of compensatory strategies as long as we can. And of course, people vary in how long, what this journey looks like, what the deterioration is going to be like, how slow, how fast. But it's a very difficult kind of aphasia to deal with.
Yeah, no, it sounds that way. And now, are there, and again, I'm just going to slightly just veer off some of these questions that you'll be able to answer them. Is there a specific type of aphasia that occurs due to a specific type of stroke that has occurred? So a stroke in terms of the brain. So a stroke that has occurred on the left hemisphere, or in the left hemisphere. What type of aphasia is more dominant to occur than if there's a stroke?
So a left-sided stroke generally has an associated right-sided paralysis or paresis, weakness of the arm and the leg. That aphasia often is a non-fluent aphasia known as a Broca's aphasia, where the language is quite limited in length. You won't see the typical grammar and syntax that you expect from people. And a right-sided stroke is often accompanied more with cognitive deficits and what we call dysarthria, where the speech production itself is affected, and you might see slurring of speech. The voice may also be affected and be more monotone, breathy. Attention, focus, those areas may be impacted. Again, the cognition. So cognitive load is a very important part of how you work with people in therapy, not increasing cognitive load to a point where the patient is struggling. The affect on people who have right-sided strokes is sometimes affected as well. It can be more flat. Left-sided strokes can also be, very severe and cause what we call a global aphasia, which means that all the areas of language are severely impacted: reading, writing, talking, listening. But cognitively, those people are very often very intact, very alert, very oriented, and are communicative in all sorts of other ways. Drawing, gestures, vocalizations. And we encourage that in therapy because with each patient you work, you want to find what is unique to that person's interests, personality, so that you can maximize the strategies that they use to communicate.
Right. No, absolutely. And now when it comes to treatment for aphasia, what type of treatment do you and other speech therapists use in order to help them with their deficits?
Well, again, most people offer individual and group treatment. The groups are very important because they provide socialization, support. They give people an opportunity to, work on their skills in a group context. The individual therapy, I think, needs to be tailored, again, to the individual. And the relationship that you have with the client, with the patient, is significant to the success of the therapy. Whether you're using the person's interest in flying, for instance, maybe the person was a private pilot before this happened to him, using that interest to stimulate language, using that interest to help him understand what's being said because he already has a frame of reference for that subject. So we use stimulation in any way that we can, depending on the severity of the aphasia, and again, depending on the person's educational background, what his linguistics ability were before. So the age, how sick or healthy that person is at the time that he had the stroke is going to affect his ability to attend and persevere. How depressed is this person? Yeah. How much is that depression impacting on his daily life? Does he have people in his life who are significant others who can help and are actually contributing to the process? I always like to have the spouse in some of the sessions because ultimately it's going to be the caregiver, whoever that happens to be, who is with that person most of the time. And you really almost want an assistant to what you're doing. And again, that means I'm going to be getting information from that person to help me tailor that therapy. So again, it suits this particular individual.
Right. Yeah, absolutely. And now when you get to voice, so we just spoke about aphasia and stroke rehabilitation, but for voice, who should seek out voice therapy? I mean, clearly it's actors, actors, actresses, but there clearly are other people too. Are there specific voice disorders?
Yeah, I think there are guidelines, and it doesn't have to have mushroomed into a full-blown disorder. But if a person is noticing that the voice is starting to interfere with his activities of daily living, when he can no longer use the voice in all the ways he expects to or she expects to, on the job, reading stories to the kids at night, communicating with a spouse who has a hearing loss and they can't do that anymore, and they're finding that they're using their voices to do that, which isn't really the most efficient way to communicate with somebody who has a hearing loss. At that point, it's a good idea to see an otolaryngologist and have a laryngeal exam and see what's going on. And again, it may just be something, that's beginning. that the patient notices roughness or breathiness in his voice. A singer may notice that his or her pitch range is limited. She can't hit the notes that she usually does. It takes longer for her to warm her voice up in the morning. A customary voice user might notice that in the morning the voice is worse and gets better as the day goes by, which might indicate they have some acid reflux, because that's a typical characteristic of acid reflux, that there's a lot of mucus in the morning and you have to clear the throat a lot. And that's something that speech pathologists also make recommendations about because it affects the voice.
Right.
So, people who have children are often very vulnerable to voice problems, and that's a typical person in our lives, isn't it? You find yourself yelling too much. I would imagine, parents today are having a very challenging time being at home with their kids as much as we are, and having to keep them entertained and interested is very difficult.
Absolutely. And I also think,
yeah.
It also is, I also think, and it's not necessarily just, speech and language, but it can also carry on to learning disabilities or behavioral problems. But, for a parent to be at home and dealing with all of this instead of going to there's, special education school where they are, so forth. I mean, it's double the challenge.
Many challenges, yeah. And stress and depression negatively impact everything.
I know.
So we're seeing a lot in this country right now. There's more domestic abuse because people are, together more than they were. So things are just on fire in a way.
Right. Absolutely. And so do you think that's a result of why the pandemic and COVID and everything is a reason why, you've seen more people, want to do voice therapy, specifically you spoke about masks and how that's...
Yeah, well, I think there are a couple of reasons there. One is, as I said, wearing a mask is making all of us use more effort when we speak to communicate. We don't have the cues we usually have with the face. So we're trying to use our voices to communicate the message in a way that puts a lot of strain on the mechanism. We've actually developed in the singing community what they call a singer's mask, which is a mask that's much larger and has a larger resonating space for singers so that they can get the feedback that they need for singing. Mm-hmm. But in terms of why I have more people, or a lot of people right now, it's a good time for people to work on their voices because they're home. So, we know one day this is going to end. Mm-hmm. We just don't know when. So many of my transgender clients, for instance, are taking this opportunity to work on their voices so they feel their voices are where they want to be when they are ready to, again, take off the mask and go out and socialize as much as they did before. Yeah, so this is a good time to do that. With other people, it's a very important way to stay connected and keep working on their skills so they're not so isolated. And now I'm talking about the stroke rehabilitation as well, or whatever kind of therapy it is, to keep improving your skills so that when the time comes, everything is working better, mm-hmm. Or we may even be finished with therapy by that time.
Yeah, no, I mean, we hope, the sooner the better, because like you said, this is a very stressful and, quote unquote, depressing time for a lot of different people. And we don't know when it's gonna potentially go away. I mean, obviously we've had some liberties and, with the phases and the, lifting, of some of the restrictions, at least in, New York State, but
we still have to be smart.
Yeah, absolutely. Absolutely.
We're going to lose that.
Exactly. Absolutely.
Yeah, we have to be smart.
Yeah, you definitely really have to be smart. So what resources are there for people who want to seek speech therapy, support groups? I know that, and we spoke a little bit about how resources can be costly, what resources are there for, free or, a low cost,
Right.
treatment
Well,
or help.
at Adelphi, we offer not just the transgender services at no cost, but all of the services that we provide for other kinds of problems are at a very low cost.
Okay.
The groups are free. For instance, they have several aphasia groups that have been running for long periods of time. Those are free. But contacting the American Speech and Hearing Association is one of the first things that I would do, because they will, state by state, give you a list of people and places who provide the service that you're interested in. And then you can directly contact those people and find out, what they offer, what their costs are, what their services are that they provide. Yeah, that's the first place that I would go.
Okay.
Because it's our organization. Yeah.
Absolutely.
Yeah.
And now, and I guess this is more in closing, but what advice would you give to somebody who's struggling with, a stroke? They've just, they now have aphasia or voice disorders, or a loved one who is, dealing with somebody that is speech and language impaired or voice impaired too?
When you say what advice, do you mean in terms of their day-to-day life or seeking help or?
I would say day-to-day life and then also seeking help.
I think it's very important to seek therapy very early.
Okay.
Because there is a period of spontaneous recovery that people go through when they've had a stroke, where progress is very, very rapid, and you will see a lot of changes, which is very encouraging. We know that changes occur forever. They just get slower and smaller, but they continue, because as people develop compensatory strategies, they get better and better and better at using them and then functioning, more in the context of what they're used to. So I would say do it early, get help early. And very important that the family be included in whatever treatment decisions are being made, that the therapist be there to provide information for you, that you have an opportunity to counsel the caregiver, even without the client being present. Because, often a spouse or, a child, a daughter or a son won't want to say certain things about what's going on that are difficult for them to cope with while the mother or the father are present. So it can be very useful to work with the therapist that way as well, without the patient present. But I think you have to know, very specifically what's going on in each individual case to say what the person should do at that time.
Right. I think that's great advice. And now for people, since you are treating people still, who are interested in the New York, they're in the New York City area that want to come and do speech therapy with you, how do they find you?
Oh, well, they can find me through email. You have my email.
Yes. But your website, right?
My website is, if you put in Irene Kling, my website comes up.
Okay.
Yeah, and or they can email me at kling at adelphi.edu.
Okay.
And
There you
I
go.
will answer them.
Perfect. Sounds
Yeah.
good.
Yeah.
Well, thank you. This was wonderful. All righty.
Stay
Take
well.
care. Be well. Okay. Bye.
Bye-bye.